Welcome, everybody, to the OPT Network. Sometimes we think that the men in our lives are invincible. Well, they're not. And it's up to the women in the family, I believe, to really get onto men and say, we've got to get you to the doctor. Not because we think that you're sick, but because we want to make sure that you're well. Our guest this morning is Jeremy Wiley. He's a family nurse practitioner at Christus Health. And today's segment is all about men's health. Jeremy, good morning and welcome. So, Jeremy, one of the hardest things for women who love men is getting them to the doctor. And so we want to just really encourage men and women that it's important that men have health checks. And so what are you seeing over these many years that could be corrected or treated quickly if men got the checks that they needed?
Well, whenever you talk about that, your primary visit with your provider is your chance to have a provider that gets to know you. And when you have a provider that gets to know you, they're knowing your history as far as whether you have high blood pressure, cholesterol, any kind of health problems, they know you. They're also going to be checking for your, just having discussions with you about making sure your colonoscopy is up to date. They're going to be discussing with you prostate health, which they're going to either discuss with you doing a digital rectal exam or discussing having a PSA level check. So, and all that intertwines together with men's health.
Mm-hmm. And one of the things that men, I think, are most guilty of is that if they're not having some sort of physical pain or physical problems, they really aren't going to go to the doctor. And even if they're having physical problems, there's still some woman in that man's life that is saying, you are going to the doctor. You know, talk about why it's important for men to understand things like blood pressure and cholesterol.
Well, blood pressure and cholesterol can both be related to problems such as erectile dysfunction. And a lot of men do not like to talk about it. That becomes an embarrassing topic and not something that men just really want to go to say, hey, look, I've got this problem. But for us on the primary care side of things, when you come to us and say that, we're going to start thinking, okay, is there other things that we need to be checking to make sure that your health is optimal? And so that's a very important topic to have with your provider.
Right. And so when we start talking about erectile dysfunction, that means that the penis is not being able to have an erection for sex, I'm guessing.
Right. Just the inability or maybe not fully. And so you think about it, it's vessels. Mm-hmm. And if there's problems with vessels down there, there could be problems with vessels up here.
Right. And so that's such a touchy subject that a man may not even want to talk to his primary care physician about. And I think that a lot of men suffer in silence, you know, because it's such a pride thing. So how best to approach a situation like that with your doctor?
Well, and that makes full circle back when we started. Remember whenever I said that getting a primary care provider, somebody that gets to know you, mm-hmm. You get that close relationship with them. That way you can, they know you, you know them, and you can have that candid conversation.
Mm-hmm. Absolutely. And one of the issues that many men in their lifetime will be faced with is prostate cancer. Talk about what now the statistics or the studies are saying, because it seems like from year to year it changes when men should be screened for prostate.
Right. So there's a lot of different opinions and schools of thoughts related to prostate exams. There's two different ways, as mentioned, that you can do it, the digital way or by the PSA level. So really, men probably, it's best to start having these, discussions at age 35 or so, at the very minimum. By 40, they're probably going to have had one of the two tests. And usually is something that you need to have a discussion with to say, the risk versus the benefits for each one, because no test is perfect. But it's important to get those baselines and to start having that talk.
Mm-hmm. And let's talk about kidney function. So blood pressure affects not only erectile dysfunction, it also affects Kidneys.
hmm Yes. So untreated blood pressure, we all know that it can cause strokes. It's called a silent killer. Um, and over a prolonged period of time, untreated blood pressure can cause kidney damage.
hmm And is blood pressure also, it's also directly related to whether or not a lot of men have not taken high blood pressure medicine. And I've spoken to many wives that have said, you know, my husband has high blood pressure, but he refuses to take his medicine.
Mhm.
And so that also is problematic for a man having an erection. So how do you rectify the fact that I've got high blood pressure, but sometimes the medicine, you know, prevents me from having erections?
So if you're having that problem, we know that there are certain medications that can cause that problem. So if the male has that issue, they should have that discussion and say, hey, look, ever since I've started taking this, I've had this issue.
Mm-hmm.
Let us know, because there's other medications. And sometimes the first medication may not be the right. We can change it, we can adapt it, and make your care customized for you.
Mm-hmm. And, you know, we're in central Louisiana in the South where, you know, it's just hard because we love our food and we love our alcohol in many cases. And so what's the most overarching message that you would send to men about being proactive about their health?
Well, when it comes to our individual health and men's health, it's our responsibility as a patient to advocate for ourselves. Nobody else is going to do it for you. That is our responsibility. And that can go whether male or female.
Mm-hmm.
And the main thing is to make sure that you are taking the initiative to get those appointments, to follow up with those appointments, and anything that leads from that. And as far as diet and alcohol, you know, on that right there, as a healthcare provider, we got to say, you know, we know that alcohol is not necessarily good for the body. We know that overeating is not good. So we want to make sure that we're putting healthy options into our body.
Absolutely. And as we talk about, you know, fathers and husbands and, you know, grandfathers, we want men to be healthy and to be around for a very long time. And I know conversations like these can sometimes fall on deaf ears, especially if you feel well.
Mm.
But it's really, really important that all of the screenings like prostate and, you know, colonoscopies, what are
Right.
the ages now that men should be having colonoscopies?
Well, it's interesting that you brought that up. Right now, about 45 is the recommended age for colonoscopies. However, if a person has a significant family history, they may back that back to age 40. So it just depends on what your insurance coverage is and what your family history is and the degree of relative that had cancer in your family. I will say this. Now, after you have your first colonoscopy, if it is a normal colonoscopy, they may back it off every 10 years. If you've had polyps and stuff like that, they'll probably do it sooner.
Mm-hmm.
Now, there is another alternative out there, which is a lesser alternative, but it's still a good viable option to have done in the interim time. And that's, you know, we've heard of Cologuard.
Mm-hmm.
Now, Cologuard is not near as good as a colonoscopy because we both know that direct visualization is the best option right now.
Mm-hmm.
But both are still a good discussion to have to decide with your primary care provider which option is best for you.
Absolutely. And so, Jeremy, are you seeing quite a few men in your practice? Are you seeing men come through and being able to be open and sort of honest about where they are in their health and in their health care?
I would say it's probably about 50-50. You have some people that are very, very good about telling you what their problems are. And there's some people you have to kind of dig around before you figure out what's going on.
Mm-hmm. And I think it goes back to the very beginning of the conversation, making sure that you have a healthcare provider that you've established rapport with and
Mm-hmm.
that you can talk to about things that may be embarrassing to you, but certainly are not embarrassing to the provider. Jeremy,
Right.
we want to thank you for, sharing the information and really making sure that we get the message out to those people who love the men in their lives, who may be a little bit stubborn, who are just not going to go to the doctor unless they just absolutely have to. And
Absolutely.
in today's culture, we know that sadly can be very dangerous.
Yes. And it's all about, getting that appointment and having that first conversation.
Indeed. Jeremy, thank you so much for all that you do and for all that Christus is doing to be agents of change in our community.
You're welcome.
Hey, everybody, stay on point. We're back right after this.